Imagine you're at the dentist. Everything seems normal. And then they say, "We found something." Suddenly you are wondering, is it serious? How much will it cost? Hi everyone, welcome back to Oracore. Today we're taking away the fear and the confusion. I'm breaking down exactly what happened next, what your options mean, and how to take back control of your health, and especially your smile. Let's dive in. First off, what's a cavity? Or how serious they can be? Before I answer all the questions you might have, let's understand a little bit more about what a cavity is. Think of your tooth like a house. The outer shell, the enamel, is like the sturdy roof protecting everything inside. Every time we eat or drink sugary foods, the natural bacteria in our mouth feed on those sugars and create acid. Over time, that acid wears down the roof, creating a tiny hole. That hole is what we call a cavity. If you want to know about how a cavity is formed, I explain it in much more detail in another video, link in the top right corner. Now, are cavities a big deal? Well, it depends on when you catch them. At first, a cavity is just on the surface. You won't even feel it at all, no pain. But if you ignore it, the decay digs deeper into the soft layer underneath called dentin. This is when you start feeling sensitive to hot coffee, ice cream, or sweets. If it keeps going, the decay hits the very center of a tooth, the pulp, where all your nerves and blood vessels live. That's when you get a throbbing toothache, potential infections, and major problems. The main takeaway: the earlier you catch a cavity, the easier it is to fix. How do dentists fix them? There are three main options depending on how deep the damage is. Let's start with a feeling. Think of it like patching a small pothole in the road. If the cavity is small to medium size, the dentist simply cleans out the decay spot and fills it in with a tooth color material. Quick, easy, and your tooth is good as new. While the crown, remember the pothole? What if the pothole is huge or half the tooth is broken? A simple patch won't hold up. That's where a crown comes in. A crown is like a custom helmet or cap that covers the whole visible part of a tooth. It seals it up and gives it back its original strength so you can chew without worrying about it cracking. And finally, we have the famous root canal. But don't let the name scare you. A root canal is actually the hero that saves your tooth from being pulled. If the bacteria makes it all the way into the center nerve of a tooth, it causes an infection. During a root canal, the dentist goes inside, removes the infected nerve, cleans out the area, and seals it up. Because the tooth loses its internal blood supply after this, it becomes a bit brittle, which is why a root canal is almost always finished with a crown over the top to keep it protected. So we talk about cavities, but what about cracked teeth? Teeth are strong, but they aren't indestructible. Whether it's from grinding your teeth, chewing on ice, or just an accident, cracks happen. Here's how we handle them based on the severity. First, you might see like a tiny hair-like lines on your enamel, like these ones right here. These are also called crease lines. Usually, they're just superficial surface scratches. They aren't painful and usually don't need any treatment at all. Then there's a broken cusp, like this one right here. So the cusps are the pointy biting part of your back teeth, like this one, also this one, and all these ones right here. Sometimes a piece of that biting surface just chips off, usually because there was a large filling underneath weakening it. It might be sensitive, but since it's just a top part, it's usually easy fix with a filling or an online treatment. And then now we're going to be showing you here that if the crack goes deeper into the tooth, as you can see right here, that's when we get a little worried. If it's a significant fracture, the tooth needs to be held together so the crack doesn't spread. This is where a crown becomes your best friend. It acts like a splint or an ring around the tooth, holding everything together and preventing the crack from splitting your tooth in two. When is extraction necessary? Well, the worst case scenario is when the crack travels all the way down into the root. If the crack is deep enough to reach the bone or the center nerve, the tooth unfortunately can be saved because it's physically split in half. In this case, extraction or removing the tooth is the only way to stop the pain and prevent a serious infection of your jawbone. The golden rule here: don't wait. A tiny crack is easy to cap with a crown. A split root, that's a much bigger problem if you feel a sharp zing when you bite down. Call your dentist. Don't let a small crack turn into a lost tooth. Did you know you can have perfect cavity-free teeth and still lose them all? It all comes down to your gums. Here's what you need to know about gum disease. Let's talk first about gingivitis. So, here your gums are red, swollen, and bleed when you brush or floss. This is just surface inflammation caused by plaque buildup. The good news? It's 100% reversible with better brushing, flossing, and a standard dental cleaning. But periodontitis, well, if ignored, gingivitis turns into periodontitis. The infection sinks below the gum line and starts destroying the bone that holds your teeth in place. Once that bone melts away, it doesn't grow back. Now, let's talk about the fix, which is called deep cleaning. To stop the bone loss, a regular cleaning won't cut it. You need a deep cleaning, which is also known as scaling and root planing. We numb you up and scrape away the hardened tartar and bacteria hiding deep beneath the gums so the tissue can heal. So remember, healthy gums are the foundation of your smile. If your gums bleed, don't ignore it. Get them checked before mild swelling turns into permanent bone loss. Do you actually need to get your wisdom teeth removed? And why do they cause so much drama in your mouth? Let's break it down. If your wisdom teeth grow in straight, have plenty of room, and you can reach them easily with your toothbrush, they can stay. Some people have enough jaw space to keep them for life, just like any other molar. Why do they cause problems? Well, for most, our jaws just aren't big enough. When they are impacted, which means they are stuck under the gums, they create a tiny pocket. This trap is impossible to clean, making it a playground for bacteria, leading to painful infections or cavities on the healthy molar next to it. We recommend extraction if they are causing pain or recurring infections. Also, if they are pushing other teeth and ruining your alignment. Or even if they are actually damaging the roots of your neighboring teeth. Your dentist will use an x-ray to see if you have enough room to behave or if they are planning trouble. Don't wait for the pain. Get them checked during your next exam. If your face starts swelling up or you have a throwing relentless toothache, listen up. You might have a dental abscess. This is not just a cavity, it's an infection and it's a dental emergency. But what is an abscess? Well, it happens when bacteria invade the very center of your tooth or your gums, creating a packet of pus. Your body fights back, which is exactly what you get the painful hot swelling. But what are the warning signs? Well, if you have severe throwing pain, a fever, or facial swelling that makes it hard to swallow or even breathe, this is serious. The infection is spreading. And what is the treatment process? Well, if you have an active swelling, your dentist will prescribe antibiotic to knock down the infection and keep it from spreading through your body. But sometimes we have to get the source of the infection out. So you will need either a root canal to clean the inside of the tooth and save it, or an extraction to remove the tooth entirely. Remember, antibiotics are just a temporary fix. They stop the spread, but they cannot cure the tooth. If you don't treat that source, that infection will come back and it will be worse next time. If you're in pain right now, call an emergency dentist immediately and don't wait. Missing a tooth? It's not just about your smile, it's about your bite, your jawbone health, and preventing your other teeth from shifting. Let's talk about the 3 ways we replace missing teeth. Option 1. We have the dental implant. Think of an implant as a synthetic tooth root. We place a titanium pulse directly into your jawbone and top it with a crown. It acts, feels, and looks like just your natural tooth. And it's the only option that actually stimulates the bone to keep it from shrinking. The other option that you have is a dental bridge. If you are not a candidate for an implant, a bridge is a great choice. We crown the 2 healthy teeth next to the gap and use them as anchors to suspend a false tooth in the middle. It literally bridges the gap. The other option you have is a denture, which are actually removable. If you're actually missing several teeth or a full arch, dentures are the most affordable solution. They are removable appliances that sit on your gums to restore your ability to eat and smile. We also have implant supported dentures, which snap into implant so they don't slide around while you talk or eat. Don't leave a gap. When a tooth goes missing, your other teeth eventually tilt and shift to fill the space, which ruins your bite. Talk to your dentist about which option fits your lifestyle and budget. Crooked teeth, an overbite, an underbite, or jaw pain when you chew. These are not just cosmetic issues, they are functional bite problems. Remember, when your teeth don't line up properly, your bite puts uneven pressure on your jaw and enamel. This leads to premature tooth wear, chips, headaches, and even jaw joint pain, also known as CMJ issue. But how to fix it? One of the options is traditional braces. Braces use metal or clear ceramic brackets glued to your teeth, connected by a wire. They are the ultimate workhorse. They give the practitioner precise 3D control and can fix even the most complex bite mismatches and rotated teeth. The other option you have is clear aligners. If you don't want the metal mouth look, clear aligners are custom made removable plastic trays. They gradually shift your teeth over time. They are discreet and let you eat and floss easily. But you must be disciplined and wear them at least 22 hours a day. What about the orthodontist referral? Remember that general dentists handle many simple aligner cases. A referral to an orthodontist who is a specialist in tooth and jaw alignment is essential for severe misalignments, jaw growth issues, or complex bite corrections. Has your dentist ever handed you a referral and said, "I'm sending you to a specialist"? Well, don't panic. Think of your general dentist like your primary care doctor. They do it all, but sometimes you need an expert for a specific job. Here are the 6 domain specialists you might be sent to. Let's start with the endodontist, the root canal expert. They specialize in saving teeth. If you have a super complex root canal, for example, they have the advanced tools to handle it. Now let's talk about the oral surgeon, the extraction and jaw specialist. If you got a deeply impacted wisdom teeth, complex jaw issues, or need advanced surgery, this is the domain. Now the periodontist, the gum specialist, they focus on treating severe gum disease, saving teeth with major bone loss, and placing complex implants. We also have the orthodontist, the alignment specialist. They are the pros when it comes to braces, aligners, jaw growth, and correcting your overall bite. We also have the pediatric dentist, the kids expert. They are especially trained to handle growing children, nervous kids, or patients with special healthcare needs in a super fun, welcoming environment. We also have the prosthodontist, the reconstruction specialist. These are the architects of the mouth. They handle full mouth restorations, complex dentures, and intricate implants bridges. Remember, a referral doesn't mean something went wrong. It means your general dentist wants you to get the absolute best and most specialized care possible. Now, let's talk about if an early treatment matters. Well, when dentists talk about prevention, we are not just trying to save you money. We're trying to save your peace of mind, your confidence, and of course, your smile. Tooth pain is not just physical, it's emotional. It's the constant anxiety of wondering, is today the day my tooth breaks? It's like hiding your mouth behind your hand when you laugh, or it's pulling away in family photos because you feel self conscious. Remember, ignoring a small issue steals your joy long before it steals your tooth. Taking 2 minutes to floss at night or going to your checkup is not just a chore, it's a self care. It's like choosing to live without throwing late night pain. It's protecting your freedom to eat your favorite foods. Catching a small issue early is not failure, it's a victory. Take care of yourself today so your smile can carry you through every milestone tomorrow. You deserve to live pain free. Remember, keep up with your daily brushing, flossing, and regular checkups so you catch things early. If you found this helpful, hit the like button, subscribe for more health breakdowns, and drop any questions down in the comments below. Thanks for watching, stay healthy, and see you in the next video.